Good morning. It's Friday, August 13th, so it must be time for another legislative update from your North Carolina Medical Society. And this week, the main focus, the star of the show, was the House budget. Now, you may be reminded that last week we focused on the healthcare portion or the HHS portion of the budget because that's what we saw in one of the committees. However, we didn't see the full healthcare budget or the full budget, which was released late Monday afternoon, early Monday evening for a vote to start this week. And the final vote on both the second and third reading was 72 to 41. So some bipartisan support within the bill, with a few Democrat votes swinging over to vote with the Republicans on this bill. Now, there are a few highlights that I want to point out to you that are a part of the Medical Society's legislative priorities. First, House Bill 149. This is the telehealth coverage parity language was included as a policy provision within the House budget. We did not see that in the Senate budget. As a reminder, that is common. That is a negotiation or trade. The Senate puts policy in their budget, the House puts policy in their budget, and we're likely to see this as part of some type of compromise as we move forward. But wanted to point that out to you that did make the cut in the policy pieces in this budget. Also, we saw funding for the Brody School of Medicine, which has been a priority for the Medical Society for some period of time, both in the House and Senate budgets. So that's good news. Also in the House budget, we saw $36 million appropriated for local health departments. And this is really important, one for COVID-19, but also for other communicable disease efforts as we move forward throughout this process. I do also want to point out to you that there is $1 billion in this House budget for investment in broadband. And this is unlike any kind of investment we've seen before. So this is the most in North Carolina history investment in broadband technology. The speaker did announce last week that we are going to head into that conference process starting early in the week next week, appointing conferees. So these will be the point people responsible for negotiating on the House side, and then Senate will appoint conferees as well to negotiate between both groups about what their final budget product will be. So we'll stay tuned to that, watch that very closely, and keep you updated on that process as we continue to move forward with the budget here in North Carolina. Also simultaneously happening this week, I wanted to point out that we're also working on redistricting. The legislature has started that process, likely to have that census data within the coming weeks. So that's something that's going on down on Jones Street as well too. Now, two bills also moved this week that I want to point out to you. One, Senate Bill 35, which updates the child marriage laws in North Carolina. I know our pediatricians will care about this. This raises the age. If you want full details about the bill, please check out our legislative blog for more information on it. But we're excited that this is continuing to move forward in both chambers. Next bill I want to point out to you is House Bill 608. This is the Dignity for Women Who Are Incarcerated. This charge has really been led by the North Carolina OBGYN Society. We've been thrilled to partner with them in supporting this bill to improve both maternal and infant mortality here in North Carolina. So that bill will move on to Senate Judiciary, where we hope it will receive a favorable vote, but we'll keep you updated on that. We do have some committees already scheduled for next week, including House Health Committee, so likely to be another busy week with a lot to update you on. I do want to say I'm really excited to attend the North Carolina Spine Society meeting this weekend. As a reminder, if you would like for me or someone else from our staff to come and talk to you, provide a legislative update, a regulatory update, please reach out to us and let us know. We're always happy to do that. I hope you have a wonderful weekend, and we look forward to talking to you very soon.